Hello everyone. Today we're going to be having a short live discussing Ketamine Assisted Psychotherapy. My name is Rifki Weiss and I'm a clinical social worker in Brooklyn, New York, and I practice Ketamine Assisted Psychotherapy, which in short we're going to be calling KAP. So this is going to be in a question and answer format, but before we get into the questions, I'm just going to give a quick overview of what Ketamine Assisted Therapy is. What is psychedelic therapy, just so everyone understands. So the term psychedelic was derived from two Greek words, which means mind manifesting. Psychedelics have actually been used in ancient spiritual ceremonies for thousands of years and have been used to promote wellness and healing. It's only recently become popular in the Western world. Ketamine itself has been approved in about 1970 and used to be used as an anesthesia. It was safe to be used in adults and children and has been used for years. Recently, it's been discovered that ketamine can also be used as a psychedelic in therapy. Currently, ketamine is the only psychedelic that's been approved by the FDA for any type of therapy or to be used in any type of therapeutic environment. At lower doses, ketamine can disrupt negative feelings and preoccupations, and it has pain-relieving and trance-inducing properties which allow people to view their memories and experiences without going into a flashback or distress. This is why it's become so useful for people to process traumas, PTSD, and other unpleasant past experiences. What's the difference from ketamine-assisted psychotherapy and ketamine clinics? So ketamine has also been used a lot ketamine has been used as a therapy for many different uses. KAP specifically is used for PTSD, OCD addictions, treatment-resistant depression, and suicidality. But ketamine has also been used a lot for pain. Some people use it for chronic pain. People that are in hospice or have cancer have used it as well. We're going to be talking more about KAP, which is Ketamine Assisted Psychotherapy. In KAP, we combine ketamine together with other trauma treatments, which allows a person to go deeper than they've ever been able to go before in regular therapy sessions without going into emotional distress or flashbacks or dissociations. So I'm going to go through some of the questions that were sent in through the OK Clarity forum. So this is our first question. Does ketamine therapy help for trauma? I did CBT, but still feel my emotions kick in when it comes to connecting to people. So absolutely, one of the uses for ketamine is for PTSD and different traumas. But there's a larger question of who is a good candidate for ketamine-assisted psychotherapy. And should you be using ketamine-assisted therapy in your healing journey? So this will lead us into our next question, where I'm going to explain this further. So this is from another person that sent this in. I went for a consultation for ketamine treatments because I'm desperate for relief. The practitioner said I wasn't a good fit, but wouldn't explain why. Can you explain what makes someone a good fit for ketamine or not? She did mention that maybe down the line I will be a fit for ketamine. So the first thing that's important to know is that before anybody does any psychedelics or ketamine therapy, they should be evaluated by a medical doctor. And the reason for that is that there are certain medical conditions and medications that are contraindicated for ketamine use. One of them is people that take medication for blood pressure. Also, people who have medical conditions such as issues with their bladders or their kidneys need to discuss this with their doctor. Certain medications also can contraindicate ketamine, and the ketamine simply won't work. So, for example, people that are taking benzos, most of the time, if they're able to, won't take the medication the day of treatment. But all this needs to be discussed and evaluated by their doctor and their medical professional. So besides the medical evaluation that needs to take place, and I know this varies state by state, I believe in New York it has to be somebody with an MD license, like a psychiatrist or a doctor, that can evaluate and prescribe for ketamine. Different states have different rules. When it comes to a mental health perspective, there are certain conditions that would contraindicate psychedelic use. One of them is a family history of schizophrenia, or people who have experienced mania or are currently experiencing mania. People who have experienced mania in the past, for example, somebody with bipolar, could be a candidate for ketamine when it's under control and it's being monitored by their doctor. But we would never want to do a psychedelic session with somebody who is currently in a manic state, because that can cause further damage. So this is kind of an explanation of medical reasons why people would or wouldn't be a good candidate for ketamine, and also some mental health conditions that could make somebody question whether it's a good fit for them. Besides that, there are other things to consider when someone is thinking, should they be using ketamine assisted therapy? While it's very healing and has shown, and people have been very successful with it, it's not for everyone. Some of the things to consider is that it is expensive. And the reason why it's expensive is that each session takes much longer. Can be up to 4 hours, sometimes even more. And that takes a big chunk of time, and many people need multiple sessions. Another thing to consider is that healing is great, and we all want to heal, but the journey with ketamine can be very difficult. Some people have very pleasant spiritual experiences and journeys, while others find that they're having a hard time functioning, going about their day. Some of the side effects of ketamine treatment, while temporary, can impact a person. Some people have reported feeling dizzy, feeling a little bit out of things, feeling a little nauseous, feeling a little bit dazed, even for several days afterwards. So this is something to consider depending on your family situation, your work situation. Is it, also even choosing, even if somebody wants to do it, when is the right time for them to do it? On the day of a ketamine session, usually you're not allowed to drive. Most of the practitioners will require somebody to pick you up. Some will allow you to go home with an Uber, but it's pretty expected that you're going to have a hard time accomplishing major tasks that day, and you will need to rest, because your body is going through something and it needs to be considered. Another question that came in is, in what case would you recommend that ketamine therapy? I'm currently in therapy and on medication, yet feel that I have more to work through. Would you recommend it? Or is it viewed as sometimes opening Pandora's box that isn't necessary? And that's a very good question, and a lot of clients have this question, and they often wonder about it. People talk about it. Many people will tell you how helpful it's been for them, but how do you know if it's a good option for you? So first, it's important to discuss it with someone that knows you or has been working with you. If you're in therapy, or you have a therapist or someone else you trust, to discuss it with them and figure out, is this a good option for you? Ideally, I can't speak for all practitioners, but most practitioners that I know that practice KAP therapy would not just do it with a client in the second session. They take time to get to know you, to understand you, understand your history, what you're struggling with, what your goals would be, and would then make a decision together with you if this would be a good fit. Ketamine has definitely been helpful in helping people with trauma, PTSD, complex trauma, but it needs to be done with consideration of, are you ready for it, and what are your goals? In KAP, we don't just take ketamine for immediate relief, but we usually go into it setting our intention and figuring out what we want to gain from it. People have often asked how ketamine assisted psychotherapy is different than clinics. As we mentioned earlier, when somebody is going for ketamine in a clinic, they will usually get their treatment. Very often clinics will use IV infusions, and you get the ketamine and then you leave. Most of the time, there is nobody sitting with you or doing therapy with you afterwards. They rely on the medication to be healing, and the medication does heal. And depending on what the reason for doing ketamine, sometimes it's enough and it's very helpful. I found in trauma treatment that combining therapy with ketamine has been more effective, and there's a lot of research that shows that KAP has more long-term effects than just ketamine sessions, because you are using the medication, which is very healing, but you're also combining it with other trauma work, which allows you to go deeper. another thing that people often wonder is, another question that people often wonder is, what if I had a bad experience? What if it's not what I want it to be? What if it's scary? And the truth is that there are no guarantees. And sometimes people have experiences that do feel, the ketamine does reduce terror and fear, but sometimes people have experiences that still are not pleasant. They don't understand it. Sometimes people will relieve past traumas, and it can be a little scary, especially before you go into a session. You don't know what to expect. So the answer to that is that all journeys come to an end, and knowing that it will end can be comforting. There is also I was told this by a paramedic, that sometimes when somebody is in a place that they're not feeling okay, or they feel like they need to end it right now, is that drinking something sweet like orange juice, or eating something sweet like a candy, can help bring you back from a ketamine journey and lower the effects of ketamine. Ketamine generally metabolizes quickly, depending on what type of ketamine you're taking. It can metabolize anywhere between an hour to 4 hours. But even though the effects may still linger for the rest of the day, like I said before, some people might still be feeling nauseous or in a daze, but to actually bring them back to the present, eating or drinking something sweet is very helpful. Another question that people often ask is, there are so many different forms of ketamine, which one is right for me? So there's 4 major ways of providing ketamine treatment. The first one is sublingual, which is lozenges, which is a little pill that you put in your mouth. Depending on the pharmacy where you get it from, it has to be held in the mouth for anywhere between 3 to 15 minutes, depending on how it's made. The sublingual ketamine usually takes effect within 10 minutes and generally lasts an hour, but it can take up to 3 hours. The next form of ketamine that's popular is called IM. That's an injection into your muscles, usually your arm. That will usually require, if you're doing this in a therapist's office, that will require somebody to actually come down and give you the injection, unless you're doing it with a psychiatrist who is able to give injections. So besides your therapist, it would be somebody else, like a nurse practitioner or an EMT, who gives you the injection. Will usually hang around another 10-15 minutes to make sure everything is okay, and will then leave. The reason why people like the IM ketamine is because it takes immediate effect in less than 3 minutes and gets metabolized quicker, and some people find that helpful. These 2 options are the ones that are generally used in a therapy office. There is another option that is difficult to come by in New York, and I'm not sure that it's legal in New York, and that is a nasal spray. The problem with that is that it's difficult to regulate how much you're getting, and if a person wants to, let's say, take 100 milligrams, which is a starting dose, they really need to count how many times they're spraying it, and as the ketamine starts wearing off, they give themselves more, but it's very difficult to regulate. A lot of practitioners are hesitant to use it. The last option, which is very popular in clinics, is ketamine given through IV. The reason why some people like that is because it takes immediate effect and can also be ended immediately, that as soon as you shut down the IV machine, the ketamine effects stop and the person is back to themselves within a minute or 2. This is used a lot for pain relief and is also generally used in clinics. In the average therapist's office, they're not set up for IV infusions, although some might be. Another question that people often ask, and you can find online or in different places, is ketamine groups. What does that look like? Who is it for? And is it recommended? And I know it sounds interesting, because when somebody thinks about group therapy, it's not the type of thing they would imagine as using ketamine. So the advantage of doing ketamine in a group setting is a couple of advantages. Number 1 is that it's cheaper. So for people who have a hard time affording individual ketamine sessions, joining together with a few other people makes it more possible to afford the cost. A second option is, a second reason why group therapy might be an option, is that Like any group therapy, being in a group setting is very healing. When ketamine groups are formed, they're usually formed for people who are struggling with similar issues. Some people do them for people who are struggling with overcoming sexual abuse in their past, or people are struggling with treatment-resistant depression. It's often try to peer or group people with similar situations in the same group, because after the ketamine wears off, instead of a regular integration session, you have a group sharing. So you want people who are in the same situation where they can be helpful to each other and not trigger each other. This is something that is done in many places and can be an option for anyone who feels like they want ketamine, or they have a hard time affording it, or they feel like they would benefit more from a group setting. There's something very healing by doing this together. It's also, the downside of that is that it is a group setting, it's not individualized, and some people find it difficult to focus on their journeys when they're hearing other people. Other people might be talking or making sounds, and that makes it difficult for them to focus. Okay, another question that I've gotten is, what does a typical ketamine session look like? What happens? So I'm just going to quickly go through that. So obviously, before a ketamine session is scheduled, there's a lot of discussion before with a therapist, with a client. What is your intention? What are you doing it for? You already had your medical evaluation. You already got whatever form of ketamine was decided. So on the day of a ketamine session, the clients usually come in. They have to fast in the morning because they have to fast. They're not allowed to eat or drink for about 4 hours to prevent nausea. So some people schedule it in the evening and they just plan their fast accordingly. A lot of practitioners will schedule it in the morning, 10, 11 o'clock, just to make it easier for the client. So once we have already gone through all the safeties and discussed it, on the day of the ketamine session, the clients will come in. Usually we keep the setting in the room a little low, dim lighting. During a ketamine session, most clients wear a mask. You don't have to, but it's easier to experience the medication with your eyes closed. So there will automatically be dim lighting in the room. We have special ketamine soundtracks that we play that help people along their journey. Usually ketamine is done on a couch or on a recliner because most people feel they need to lie down. Sometimes it's hard to feel your body when you're under ketamine, so laying down is especially helpful. It's hard for people to be able to get up, walk around, so having a space to be comfortable and lay is very important. On the day of the ketamine session, then we would usually discuss, again, your intention, with the knowledge that not always do ketamine sessions work out the way we plan them. We allow the medication to do what it does, but we set our intention, and then I also usually ask my clients to bring something that is comforting to them, has meaning to them. They can bring any type of object, picture, say a prayer, read a poem, anything that has meaning for them or that they can use as a grounding object. The client then takes the ketamine and goes into their journey. Some people talk, some people stay quiet. It varies person by person and even session by session. People that do multiple ketamine sessions sometimes find that each one is different. After about, depending on the person, an hour, hour and a half, once the ketamine starts wearing off, the client starts waking up, we will generally start having not a regular session, but more of an integration session where the client discusses their experiences, and then we would do different types of therapy modalities, usually EMDR, somatic therapy, or IFS. IFS is especially helpful when paired with ketamine because a lot of people find that while in their journeys, they encounter parts they didn't know they had before or they didn't have access to, and these things are coming up. So doing IFS after a ketamine session is especially helpful because it puts the parts, you get to know your parts, and then you get to speak to them and put them on the side or continue working with them in further sessions. It's also very important to have an integration session the next morning after the ketamine session because a lot of times people find that things come up, whether it's dreams, thoughts, or different experiences, different questions they had, and that's usually a continuation of the ketamine session. A common question that a lot of people have asked is how many ketamine sessions are needed. And in that vein, do you always take the same dose of ketamine? So this is really a personal situation that varies from client to client, especially dosing, which is discussed with a doctor. A lot of people find it helpful that they start with lower doses and will then go a little deeper and find that helpful in their work. Some people like to stay at the same dose for all of their ketamine sessions. So in a way, it depends on what the goal is for doing the ketamine. With treatment-resistant depression, there isn't always a timetable of how often you do ketamine. Clients will do it, and once they find it helpful, they will feel better for a couple of weeks, and as they find it wearing off, they will schedule another ketamine session. The expectation is that after a couple of ketamine sessions, which can vary, but some people estimate somewhere between 6 to 10, their depression will be manageable and they won't need to keep coming for ketamine sessions. There are also practitioners that report that they have clients that come back once a year for like a booster session. People that are using ketamine for pain management in clinics will also sometimes have it scheduled and sometimes come back on an as-needed basis. When it comes to trauma therapy, PTSD, or complex trauma, sometimes there is a schedule to how often you want to do the ketamine, and sometimes it's done on an as-needed basis. Ketamine is never recommended more than twice a week. You always have to have at least a day or two in between ketamine sessions. Some practitioners will do ketamine twice a week, kind of 12 sessions in 6 weeks. Just come in, do it, and then they will send their clients to their own therapists or their practitioners. People that often do this rapid kind of ketamine 12 times in 6 weeks are usually only doing the ketamine. The client has another therapist they're working with, so they kind of provide the service and then they send the client back to their regular therapist. KAP can also be done slowly if you're doing it with someone who is your therapist. Then it can be spread out much more. Sometimes people will do it once a month. It really varies individually. It varies how you feel after a ketamine session. If you have any side effects like nausea, dizziness, feeling dazed, how often you're able to do it, and how long the effects of the ketamine last, and how long you still feel it, and then you feel like you need a booster. Let me go back to my list of questions. What conditions has ketamine been shown to successfully treat? So this is something that's currently being studied, and I'm not sure if it's been medically recognized, but there has been an article published, I think about a year or two ago, where ketamine was successfully used to treat PMADs, pre- and postpartum mood disorders, in women who were breastfeeding. So they did a study and they found it to be safe and effective. Again, anybody who is breastfeeding or pregnant and wants to do ketamine treatments would definitely need to consult with their doctor who can sign off on that. But they have done a study that found it to be helpful. Ketamine has also been used successfully to treat PTSD, OCD, addictions, suicidality, and treatment-resistant depression. It's a fairly new type of therapy. It hasn't been studied for that many years, so there's a lot of treatment projects that are constantly there's a lot of studies going on currently. There's a study going on currently on using ketamine to treat PMDD and PMS, and there's a lot of other studies. They're using it for end of life and different types of studies, but those haven't been published yet and they haven't been released yet, so we don't really know. A lot of what we know of ketamine is new. We're still finding out a lot of information. As much as we know, there's a lot that we don't know and are constantly learning. Just going to check here if there's any other questions that I haven't addressed yet. Okay, I think that I've gone through all of the questions that were submitted. If anybody has any follow-up questions, they can send it into OK Clarity, and maybe we'll have another live to address those. Thank you everyone who joined, and thank you for listening.